Hello, I'm Rafael Franco. At this moment, I am the coordinator of the Innovation Lab in Telehealth at the the Digital Health System. And I'm here to introduce to you a new project at SMPS, which is to normalize remote monitoring for patients who will be undergoing telemonitoring. Where are we nowadays? I don't want to go too much into detail. Where are we? We're here. We're a small country. A country where you don't have a lot of distance between cities. We can go from the coastal area to the inland quickly, but you still have patients who are far away from the points of contact where they can have care. And nowadays, patients are already being monitored, many of them not using great technology, but because the healthcare professional is interested in monitoring that case, say a patient that raised some doubts, whether they do it by phone or other technologies, nowadays, healthcare professionals try to reach their patients with the tools they have available. These are the points where this is happening nowadays. But sometimes technology isn't in everyone's hands, and patients have been able to manage their health. They can register on paper, or wherever. We can evolve to a bit further where the tool is a bit more digital, but even then the patient records what's going on a sheet of paper. What we're starting to realize now is that there are ways of recording the data digitally. They can communicate such information. In 2007, I have an example where through messages, text messages, you could indicate your parameters to healthcare professionals, but from last decade, we started to be able to do more. With an internet that was more readily accessible to everyone, with the services that the web brings us, the internet brings us, institutions, patients' home, and of course, cloud, which means that we can process such data quicker. In 2014, we had important studies already addressing this area. So we have technology, and that is the gateway to move forward and do more. So we started thinking about processes. In 2014, hiring at the NHS already thought about telemonitoring in these three areas where the hospitals could hire this to a series, they could do this to a series of patients. And people started to realize that there is a clear investment in this field where we want to do more, not replacing what has been done, but rather do more. And the National Telehealth Plan was released in 2019. And given the pandemic, the operational plan has been looking at the last 2 years in a different way. Healthcare professionals are already aware that there's a clear investment, that people have this information, and there is a clear investment being made in this field, providing remote healthcare to do more for patients. Now what? What are we doing now? I'm bringing you Hubble, a telescope. Obviously, it was a satellite technology that existed. And what NASA did was wanting to see more. They already knew that what space had, but we wanted to know more. So what they did is they have this, they put this in space. It's about 13 meters long, about 2.4 meters high, and it is looking to areas of space we didn't know about. And if you allow me to draw a parallel with telehealth or remote monitoring, to be able to know more, to see what lies beyond what arrives to us on the day in which the patient comes to the consultation or is hospitalized, understand the difficulties the patient has in his or her home, get them to measure, get them to jot down their measurements and what they're doing. So all healthcare professionals would love to know what goes on in people's home. when people are discharged after a spell at A&E, after consultation. It's almost like having the healthcare professional with you at home so that next time you go over, they will be able to take better care of you. The technology exists. To know more in a more structured way, we have remote monitoring, and this is something we're investing in. The initiatives that exist at the NHS are manifold with different platforms and technologies. They are hospital-based, and they are focused in the three pathologies that most affect people. But there's also another world where the people want to do in terms of monitoring people with sleep disorders, monitoring people with diabetes, and we can even talk about dialysis. So we're building a series of opportunities where they're transforming the models that is more person-centered, whether it's easy access to more devices that are closer to the user. Patients have a lot of devices now at competitive prices. The internet and connectivity means that everyone is connected. People are more connected to the outside world through their homes. And then obviously big data and artificial intelligence, they're everywhere. So telehealth is one of the ways where we're trying to reach more patients even when they're outside the healthcare institutions. So we're trying to work on this technological response and obviously organizational responses, the processes and the procedures and the people. We want this to happen at the same time. Technological response needs to be adjusted to organizational response. So this healthcare is less sporadic and more continuous. This technological advance means that patients can register biometric parameters that many times they measure, but it's written down on a piece of paper, but also self-assessment, self-evaluation. The patient can record the symptoms, the sensations, and they can have the feedback from the healthcare professional. If the evaluation is worrying, the user or the patient is included. This is a contract, an agreement entered into. The patient and the healthcare professional know that they are working towards the same goal. This technological evolution will allow for intelligence in processing this information. It will be swifter and help healthcare professionals with some positive models will be able to anticipate problems. And here we're working towards increasing sustainability of the system, scaling up the monitoring so that it can reach everyone with more pathologies, more patients, and therefore leading to equity, not just for the institutions to have this, but for all NHS institutions having access to this type of service. It needs to be equitable. So we have a project based on, we have telemonitoring by the NHS and delivering this to the patient where I can write down this information in a more objective way. So we have the patient on the one hand and the healthcare professional on the other, where they can access this in a structured way to be able to follow the patient. I'm giving you some images of what we're working on and what we're testing. What we want to do is make this grow with our patients' help, evolving constantly, because the patient nowadays may have pathology, but the telemonitoring problems can be vast. There are a lot of pathologies, and that is the growth that we want to be on. On the other hand, the healthcare professional needs to have an easy way of accessing this information, viewing it simply. So we need to work on the healthcare professional's experience and the support that he can have to be able to handle these situations, the information that reaches him or her through the patient's house. And then there's always a very important component here, which we use the name in English, Intelligence Patient Personalized Care, which is where we can process this information quicker, in an aggregate way, and look at this evolution and bridge the patient's home and the place where the healthcare professional is. Of course, with this solution, there is the importance of interoperability in having standard protocols that are currently in force. The app for the patient needs to be able to be used to send normalized and structured data. We need to have the capacity to process this information. We need to have the capacity to have the structure grow, and then obviously work in the models that can assist the healthcare professional where the guidelines are defined. So, where are we going? This is our outlook. And I think that we need to count on everyone's collaboration for this future path. More and more, the word integration needs to be included. Not just integration of healthcare, where we hear about it the most, but also the integration of solutions and training to best serve the patient. This exchange means that we will continue to share the best experience of the NHS to where we have telemonitoring and help build this success. So what we will need to look at more is that the house and the place where the patient is may be part of his or her or NHS's digital ecosystem. The patient's home is relevant nowadays because it offers valuable information for providing healthcare. And whether it's remotely or a home visit, that information, this circle or digital ecosystem, will reach the patient's home. What we're witnessing now is that more and more areas are looking at telemonitoring with interest, and research shows us. And technological advances means that there will be more devices, simpler ways of collecting data. And that is a focus that we're looking at. Whether the areas of health and specialties, for example, movement, and tele-rehabilitation, physical rehabilitation, or whether the complexity of, say, mental health disorders, we need to have instruments we need to have fine-tuned mechanisms for evaluation. We have more and more areas involved here. We also look at the levels. Nowadays, we focus, remote monitoring is hospital-based, as I said, and we're focused locally. But we need to think about what will happen at an intermediate level in the future, or even at an international level when monitoring is needed, but the situations aren't serious and they don't need something that is closer. Lastly, we need to look at the perspective of the growth that is being exponential in terms of the devices made available for the patient, so that they are not overwhelmed with so many devices and so many ways of registering data. For the healthcare professional also, who nowadays will have various monitoring platforms, we need to standardize or normalize this experience for both the patient and the healthcare professional. But there is an area that we're not focusing on, where we need everyone's collaboration, which is managing the devices. Many times the patient doesn't have that device, and we need to bring it to the patient's home, ensure it is being connected, ensure it is being used in the best way, and that is the maintenance and management services that we need everyone's help for. And that was a brief summary of what we're doing and where we're heading with remote monitoring and this project, telemonitoring, by the NHS, and the project that SPMS is here to show you. I hope you enjoyed it. See you next time.